So I'm guessing you're already loving our presentation so far this morning, wondering how about next year? Are we going to join together perhaps for a live event? Well, there are actually 2022 options that I want to just bring to your attention right away. We're going to have 2 live events. Yes, Fargo, North Dakota, February 11th and 12th, and Minneapolis, February 25th and 26th. So you can mark your calendars now. We can look ahead. We can get excited about truly doing a Rock from the Heart event. I also want to mention, if you are taking any photos or perhaps you're acknowledging on social media or Twitter, like Mr. Lewis was just encouraging us to do, could you please use the hashtag Rock from the Heart or hashtag RFTH for Rock from the Heart 2021. We would appreciate that. And you know who else would appreciate that would be the sponsors of this amazing event. So Amy Johnson has worked so hard to put together a successful event, but it would not be possible without the amazing sponsors that have participated here today. So you could tag them, you could give them a shout out, you could give them a thank you. And that would include Medtronic. So grateful for their sponsorship. Also, we have the Heart Valve Disease Awareness Day, Edwards Life Sciences, the Minnesota Vikings, Abbott Labs, and Blue Cross Blue Shield of Minnesota. So please, if you wouldn't mind sharing the love with them, we know it will go a long way and it will encourage them to continue to support events like this one for you. All right, let's keep the afternoon going along. I want to take the time now to introduce you to Lindsay Clarke. She is the Vice President of Education and Advocacy, and she oversees the Alliance's educational and advocacy initiatives and campaigns that focus on diseases and conditions that disproportionately impact older Americans. So we're going to be talking all about Heart Valve Disease Awareness Day. Yes, there's an official day for it. And Lindsay produces a wide variety of resources, including brochures, films, websites, tip sheets, workshops, surveys, and even traditional and social media campaigns that educate and empower patients, caregivers, and healthcare professionals. She also works closely with the Alliance's public policy team on issues of access, research, and awareness. She's doing very important work. Additionally, as a member of the Alliance's senior team, she is closely involved in the strategic planning and execution of the Alliance's mission and goals. Prior to joining the Alliance, she spent more than 15 years, this was more than 15 years ago, she was an attorney in Chicago, and she worked for Chicago-Kent College of Law as Director of Institutional Projects. In that capacity, she oversaw projects related to the institutional progress of not only the school, but also conducted extensive research and legal analysis and produced key reports and proposals. Lindsay holds a Bachelor of Science degree from the University of Michigan with a concentration in biology and a Juris Doctorate degree from Chicago-Kent College of Law. It's my honor to welcome into our next presentation, Lindsay Clarke, Vice President of Education and Advocacy around Heart Valve Disease Awareness Day.
Good morning. I'm Lindsay Clarke, Vice President of Health Education and Advocacy at the Alliance for Aging Research. I lead the Heart Valve Disease Awareness Campaign, where we're joined by many fabulous partners, including Rock from the Heart. Most of you already know a lot about heart valve disease, but you may not realize how many people are dealing with it. As many as 11.6 million Americans are estimated to have some type of heart valve disease. It becomes more common as we age, with more than 1 in 10 people ages 75 plus dealing with moderate to severe disease. While some types are not serious, others can lead to major complications, including death. I talked about this last year, so many of you may have heard this, but I think it's important to keep in mind that most people don't know what heart valve disease is. A number of years ago, the Alliance for Aging Research commissioned a survey to explore awareness of the disease. What we found in this survey is that 60% said they had heard of it, but only 9% knew a great deal. When you boil it all down, 3 out of 4 know little to nothing about heart valve disease. While there can be a number of symptoms of heart valve disease, oftentimes the most common symptoms are shortness of breath, fatigue, weakness, and being especially tired. Some patients don't notice their symptoms. You can see in this survey that 35% of heart valve patients were diagnosed when they went in for a regular checkup. 15% were diagnosed when they went in for something else, and less than half went in because of their symptoms. Oftentimes people don't pay attention to those symptoms because they think they're simply a sign of getting older or of being out of shape. Unfortunately, we have heard of healthcare providers dismissing the symptoms as well. Not recognizing these symptoms means delays in treatment, and delays can have serious consequences. What this graphic shows us is that with aortic valve disease, people can be fine for a number of years, but the risk of death increases rapidly after the onset of severe symptoms. After the onset of symptoms, survival of patients with severe symptomatic aortic stenosis who don't have valve replacement have survival rates as low as 50% at 2 years and 20% at 5 years. This makes early diagnosis and timely treatment critical. These delays are compounded and made more complicated by health disparities. African Americans are just as likely as whites to get valve disease, but develop risk factors like high blood pressure, diabetes, and obesity at younger ages. Despite making up 13% of the overall US population and 11% of the Medicare population, only 3 to 4% of transcatheter aortic valve procedures, or TAVRs, and 4.8% of surgical procedures are done in African Americans. In part, this is because African Americans aren't referred for treatment at the same rates. Referral to a cardiothoracic surgeon for valve disease treatment is 54% lower in African Americans compared to whites. Further complicating this, African Americans with valve disease are 33% more likely to refuse treatment than white patients. There's a lot of really important work being done to figure out why this is happening as a first step in getting rid of these barriers to equal access to care. For instance, Dignity Health and Women Heart, two Valve Disease Day partners, are doing important research on this, and results are expected later this year. The Valve Disease Day campaign is also working to advance this important conversation. We'll be hosting a Twitter chat focused on health disparities on February 22nd, Valve Disease Day, and I'll share those details in a few minutes if you want to tune in. The National Heart, Lung, and Blood Institute at the NIH convened a working group on patient-centered research in heart valve disease in July 2019 that I wanted to be sure to highlight. The Alliance for Aging Research was honored to be included in the working group, which was chaired by Dr. Catherine Otto at the University of Washington. Dr. Brian Lindman from Vanderbilt University led efforts to draft an open access summary and the April 24th, 2020 issue of the Journal of the American Heart Association, which is designed for researchers, clinicians, policymakers, the general public, and public interest groups. You can find a link to this article on the Valve Disease Day website if you're interested. We're really excited by NIH's commitment to patient-centered research and for recognizing, as this article states, that the patient ought to be the center of our attention and not simply a valve or device. So clearly there's a lot of work to be done on getting people to understand what valve disease is, to know what signs and symptoms to look for, to be aware of the risk factors, to listen to their hearts, and to seek and advocate for the appropriate treatment. So 5 years ago, on February 22nd, 2017, we launched the Heart Valve Disease Awareness Day campaign, and we hosted the first ever Valve Disease Day event on Capitol Hill. The day was added to the National Health Observances calendar and recognized by a congressional resolution. At that time, we were joined by 29 national organizations. So after 5 years, we're now proud to have 90 partners from around the globe. We have thousands of online contributors. Our partners have organized hundreds of events. Campaign op-eds and letters to the editor have reached an estimated audience of more than 30.5 million. Radio interviews have reached around 23 million true listeners. Social media outreach has produced more than 650,000 likes, comments, shares, and other engagements. Our videos have been viewed more than 2.3 million times. TV PSAs have reached more than 300 million. Press releases have reached more than 544 million. And these numbers don't really even begin to capture all of the partner efforts that we know go on every Valve Disease Day. Pulling together the data we are able to capture, we've estimated that we have produced more than 1.2 billion impressions and reached more than 166 million people in a high impact way. We couldn't do it without our partners, and this day has become a movement thanks to our fabulous partners, including Rock from the Heart. Our partners include nonprofits, professional societies, hospitals and heart centers, advocacy and disease organizations, and more. These logos are small, I realize, so please check them out at valvediseaseday.org, and if you know an organization that wants to join, feel free to reach out. If you want to join the movement, there are a number of ways to get involved. So you can spread the word through social media, blog posts, organizational newsletters, and websites. We have created tons of assets to try to make this easier, and you can go to valvediseaseday.org to find logos and graphics, advertisements, signage, PSAs, messaging, and more. You can share your story on social media or on Valve Disease Day so others can learn from your experience. The Share Your Story tab on the website makes it easy to share. You can organize an event. Clearly, we are in exceptional times, but virtual events can have a meaningful impact. You can engage the media, share your story, your organization's efforts in valve disease, and more. You can also become an organizational partner or sign up on the website to receive update emails. If you choose to get involved on social media, we are on Facebook, Twitter, and Instagram. Post your own images, stories, and graphics, or reshare those from Valve Disease Day. Our social media team would be very upset with me if I didn't remind you to tag the campaign at Valve Disease Day and use the Valve Disease Day hashtag. So as I mentioned, feel free to just share the posts from Valve Disease Day if that's easiest on your own channels. This is just a tiny sample of posts from last year. If you're on Facebook, you can change your profile picture frame to show your support. It's easy. You just go to facebook.com/profilepicframes, search for Heart Valve Disease Awareness Day 2021, choose the frame and choose how long you want it to stay up. If you're on Facebook, you can also follow the campaign to make sure you see our posts. You can invite friends to tune in. Go to facebook.com/Valve Disease Day or type Heart Valve Disease Awareness Day into your Facebook search bar. Once you're on our page, scroll down to the community section found on the right-hand side. Click invite your friends to like the page. You can use a preset message or you can add one specific to Valve Disease Day like the one you see here. You can then click select all or click on individual friends you'd like to invite to like the page and then click send and you are set. You can share your story, as I mentioned, on Valve Disease Day or on one of our other sites, Living with Valve Disease. You can also share it on social media. However you do it, remember that hearing from others going through the same or similar experience is so powerful. We hear it time and time again that knowing you're not alone, hearing what advice others have, and finding a community of people who know what you've been through is not only helpful, but life-saving. So please share your story and let others know that they can listen to their hearts and get the care that they need. And share your selfies. This is how we show the world the movement of Valve Disease Day. So grab your Valve Disease Day sunglasses, a selfie sign, your puppy, take a pic and share it on social media. And of course, use a Valve Disease Day hashtag. I mentioned earlier, we're gonna have a Twitter chat on February 22nd, Valve Disease Day. We're co-hosting with the Association of Black Cardiologists. It's from 3 to 4 p.m. You can tune in by following the hashtag on Twitter. That will allow you to see all of the traffic and all of the questions and answers. So tune in, listen, learn, share, please engage. And then you can also join us on Monday for this year's flagship event, which will be taking place virtually. It's giving us a chance to celebrate 5 years with all of our partners. Join us at 1 p.m. Eastern and help us celebrate a valve patient and visionary, a leading cardiologist and champion of health equity, a dedicated partner, an innovative provider, and all of the partners and advocates that have helped us reach more than 1.2 billion people. Go to valvediseaseday.org to register. We couldn't do any of this without our partners and our advocates. So thank you for this chance to talk with you about this Awareness Day that is near and dear to my heart. And thanks to Amy and Pete Johnson and Rock from the Heart for all that you do for heart patients. You rock.